So spinal stenosis is the reason that somebody might have a decompression. The symptoms that go along with spinal stenosis most of the time is pain with standing and walking that is relieved by sitting or leaning forward. You may find this person leaning heavily over their shopping cart in the store, or oftentimes leaning over or bending over a counter to try to get some relief. You'll find this person hunched forward when they walk. And they do this to try to open that space where the nerves are getting squeezed. In the case of somebody who has one of the traumatic or more urgent reasons for decompression surgery, they may even have problems with control of bowel or bladder, or problems of weakness where they can't walk. Sometimes they'll even have intractable pain that they just can't do anything without moving. And the reason is that in the case of the more urgent problems, that pain has come on that problem has come on quickly, and the body just can't adjust to that. Whereas your typical spinal stenosis due to degeneration has come on very slowly over a long period of time, and the body's been able to adjust to that. Decompressive laminectomies, which is commonly referred to as a decompression, are surgeries that are performed for something called spinal stenosis. Spinal stenosis is the medical term for narrowing of the spinal canal. The spinal canal is where all of the nerve roots travel within a sac, which is called the thecal sac. In that sac, in addition to those nerve roots, is fluid called cerebral spinal fluid. When that space where the nerves are floating in cerebral spinal fluid becomes narrow, that's called spinal stenosis. And that is the reason that somebody might have a decompression or a decompressive laminectomy. Spinal stenosis is caused by a number of different things, but the most common reason for spinal stenosis is degenerative disc disease, which leads to the bulging of the disc and the buckling of the ligaments. If I could use an example of that, if you imagine the nerve sitting between my two hands, when the disc bulges outward, the ligament buckles inward. And so you see you get pressure on that space from both front and back. So in the front, most of the time that removal of that isn't recommended, because then it's just going to get even shorter or even flatter. And so we decompress from the back, and so the ligament, this part here, comes off, as does the bone, and in that way the space behind the sac of nerves becomes decompressed, and the space next to it. I oftentimes describe this to my patients like this, that the canal should look like this. When you have spinal stenosis, it looks like this, and when I do surgery, I open it up to look like that. Besides degenerative disc disease and broad-based bulging, other things that can cause spinal stenosis include fractures, where the bone goes into the spinal canal and narrows that space, infection, like what's called an epidural abscess, hematoma, which is also referred to as an epidural hematoma, something called epidural lipomatosis, which is the abnormal accumulation of fat in the space around the sac of nerves. These are all less common causes for spinal stenosis, but generally are more urgent types of surgery that require attention sooner than just simple degenerative disc disease and bulging of the disc. A decompression or a decompressive laminectomy is the removal of bone and ligament and sometimes even disc that is creating pressure on the nerves or the sac of nerves, causing that narrowing or spinal stenosis. When a decompressive laminectomy is done, we get an x-ray at the beginning of the surgery to show that we're over the area of surgery where the narrowing in the spine is. In doing this, we can make as small of an incision as possible and do as little dissection as possible. Once we've done that, we go down through the skin and into the tissue below that and down to where the bone is, and we peel the overlying tissue off of the bone and remove the portions of the bone and ligament that are behind the sac of nerves, the area where the narrowing is, so that that area of narrowing from the back is no longer causing pressure. Once that's been done, we go out to the sides on either side and we clear up any ligament or scar tissue or bone spurring so that the sides are also free of pressure as well. And once you've done that, then that space is usually nice and free of pressure. Recovery time after a decompressive laminectomy is 2 weeks of not doing a whole lot more than walking. I recommend people walk frequently, about 10 short walks daily. Because spinal stenosis causes something called neurogenic claudication, which is just the fancy doctor way of saying hurts when I stand and walk, feels better when I sit. These people have slowly over time reduced their activity, and by doing so they've allowed themselves to become weak and deconditioned. Once the nerve roots and the nerves are decompressed, the ability for the nerves to talk to the muscles has returned. The pain with standing and walking is usually significantly better, but that weakness and that decreased endurance that they got from not being active is still there. And so there is a time period where they will have to build that strength back up and that endurance back up. And that comes from frequent short walks that gradually become longer as they're able to tolerate them. For somebody going back to a job or work after a decompressive laminectomy, I would say 2 weeks is a reasonable time period to consider before going back. Oftentimes, for people who have to do heavy lifting, a lot of bending and twisting, that person is better off waiting about 3 months before going back to that.